All right. Hello, this is Bikram. I'm the founder of Bonfire Digital Wellness. We're starting a podcast series or video series with different thought leaders in the whole space of raising kids in a raising healthy kids in a digital world. And we were starting with one of our advisors who's a pediatric hospitalist, a doctor in Kentucky, and a fellow father like myself that, really passionate about raising kids healthy. And, obviously you're saving kids' lives every day. So thanks for your time and all your efforts over the year, and appreciate you being here.
Yeah, no, happy to be here. Thanks for the invitation.
So yeah, tell us a little about you. I know we've known each other for a little over a year now, and it's been really great to meet you and learn about your path to getting to this spot in your career. So why don't you tell, I don't know if people know pediatricians, but there's a lot of different roles of a pediatrician. So if you want to tell us about your role and how you got into it, and what you most enjoy about it.
Yeah, absolutely. So I'm what you call a pediatric hospitalist. So I'm a pediatrician that basically works in the hospital setting. I don't work in a clinic. I help kids that are in the ED. I'll go down and see them in the ED sometimes and say, do they need to stay in the hospital? I'll take care of the sick kids. Over my career, I've taken care of like cancer patients, patients with general medical issues. I've done a lot of like coverage in ICU stuff, taking care of newborn babies. Even in my younger days, I did ambulance transport where we went out and turn on the lights and sirens, and we're helping kids at other hospitals and bringing them back. And I've done even some sedation work. So I've done a lot of different things in the hospital, usually for sicker kids, but done some preventative healthcare stuff and done a lot of newborn care stuff too, which are like not sick baby stuff, but really like taking care of a lot of the sicker kids. And except for some of that has changed through the years, and we get like more mental health issues and things that are tough to solve, things that medicines don't fix, and that's been kind of a challenge, and kind of inspiring at the same time to like think about new things that I would want to do with my career.
Yeah, I mean, obviously talking about mental health, like how with all the kids that you see in critical, positions, and having two kids of your own, like how do you manage the stress and the emotions that are involved?
Oh, how do I manage my emotions and
Yeah.
stuff? I don't always manage it well, honestly. When I'm managing it well, I think I'm doing a lot of self-care, taking care of myself, taking time, spending time with my kids. And, I have days where I don't do a great job of that. So I try to work at it every day to make sure, I'm spending time with my two girls and my wife, and connecting with them. So that's important. And, getting enough exercise and being able to separate from work, because it's really stressful. We see a lot of really hard and a lot of really sometimes terrible things every day. But I feel like for the most part, I'm able to stay positive, and keep coming back. But there's times when it's certainly challenging.
Yeah, I mean, how is obviously the pandemic, have you, in Kentucky, how has it been in terms of the type of cases you're seeing?
Yeah, the pandemic for pediatrics has been really challenging, really interesting, and it's been different. At the beginning of the pandemic, there weren't a lot of kids getting sick, school shut down, and kids were kind of isolated. So children's hospitals were kind of empty. And then as things opened up, they started getting exposed more. We had a lot of viral illness going on out there. We had some COVID, and there were certain subsets of kids that got severely ill from COVID. Generally, children didn't get as sick as adults with COVID, but we did have our smaller segments that did. But we started getting a lot of other viral infections, and basically everything caught up. Mother Nature caught up, and everything that we hadn't seen for like months, we're starting to get like every single type of virus or bacterial infection came back. Some of the more alarming stuff that we were seeing was an increase in things like mental health conditions, just created for a lot of different reasons. But we're seeing more, kids that were having in crisis with anxiety and depression, more kids that were suicidal, more kids with really severe eating disorder. And a lot of the reasons are multiple fold. this is a problem that's been happening for probably the last 10 years, right? It's not just the pandemic, but it did get exacerbated during the pandemic. I describe it as the straw that broke the camel's back. And there was a time when people aren't getting seen and getting out and getting medical care as much during the pandemic. So it kind of got worse. Like, there was the safety nets kind of fell away. People fell through the cracks even more. And, isolationism, dealing with loved ones dying, lots of different reasons contributed to things worsening. But things have been getting worse on the mental health standpoint for kids in this country for a long time. And so that's something that I think is really important to note. But it has been stressful for kids and challenging, but in different ways you might think. So it's the mental health component is really what's roaring right now. And the viral stuff and the infections, they come and go. And for the most part, people have done well, but a lot of other things going on. There was a recent JAMA report that showed pediatric mortality is increasing in this country. And some of the reasons like suicide and accidents, shootings, lots of different things are playing a role in that overall increase in children dying. So some of them are mental health, some of them are other safety things. We seem to have slipped a little bit.
Compounds, right? Because when the kids see that, it all impacts everybody, right?
Yeah. The density of school shootings, that itself, it has a effect where it multiplies to the population and creates anxiety, depression, even like, multiple states away. It's like that thought that goes in. And with my own girls, like my wife and I were talking, like, we get things from the school and our kids are talking about their active shooter drills. And
especially after the Louisville thing recently, right? Like, did you guys get a lot of coverage? Obviously, probably national news, but locally too, or?
not a lot of cover. I mean, the Nashville thing probably got more, but it's just been, just in general has been challenging. This has been a progression that's been happening over many years, right? So it's just funny to think about that when we thought about earthquake drills and fire drills, and now to add this to it, it does add a different layer of stress, right? And it's a different thing to think about that we used to never have to think about. So kids really have it really challenging. It's really hard, and we put all these things together. It's a wonder that they're doing okay at all, but they are resilient.
They're resilient.
So,
So what like at home, and as well as what you recommend to parents and caregivers to, for prevention and being proactive, like how obviously you see that as something that, where do you see the US in terms of schools and hospital systems and society on how they prioritize prevention?
well, I think that's a huge opportunity in the US healthcare system. We're in this kind of like model where we're really good at saving people. We're really good at being reactive. And I think there's a lot of opportunities to get better prevention. I spent, before becoming the chief quality officer at Kentucky Children's Hospital, and working here as a safety leader and a hospitalist, I was at Kaiser Permanente for 15 years in Northern California. And they had a really fabulous, population health model, did great with preventative care. Not everyone loves them, but it's a model that really does good for taking care of large swaths of people, and does it pretty darn well for a lot of the routine problems.
So in terms of the caseloads that you're seeing every day, how much of them are mental health related that end up in the hospital?
Yeah, we've had more, off the top of my head, it's gonna be hard to give a number, but what I'll say is that our behavioral health units that take care of children and adolescents have been, like, through the state of Kentucky, have been completely full. Our neighboring states have been full. Basically throughout the country, they're always full. And what happens is kids are waiting in ERs. They're just sitting there waiting for beds, sometimes getting treatment, sometimes not. And then they're sitting and they start overflowing into the children's hospitals, and just kind of waiting around for beds to numbers they never have. And that's pushed on capacity too. And they're not necessarily getting the full level of therapy when they're in a children's hospital that doesn't have full behavioral health services, right? So you need specialized units And like Kentucky Children's is doing a fantastic job of building up and increasing the size of the specialized unit, but it's still not enough, right? And you're always kind of behind the eight ball. So trying to kind of like catch all the kids after they've hit severe illness. Right now, it's like we're trying to like stand in front of a tidal wave, and we just can't stop all of it that's coming, and it gets really hard to prevent or to treat. It's expensive. There's a lot of days in ERs and hospitals, and it's hard to reverse the damage that's been done. So it's better to get to it early and find it when it's just starting to emerge, and then prevent it from even happening.
Yeah. So, I mean, in terms of, I know you see them when they get to you, but so you're not really doing a lot of talking to them about prevention, but what are some of the warning signs like parents can look for that there is maybe something that's nearing crisis?
Yeah. I mean, I'll say, looking at my own children, I mean, sometimes when they're in that, like when kids are like in school, for example, they're in their like work environment like we are. That's where they spend a lot of their time. And looking and being able to talk to teachers about warning signs about what's happening, like are kids getting withdrawn? Are they experiencing things like anger? Are they fearful? A lot of kids will have actually school absenteeism. And what absenteeism is where like the kids are kind of like sick or they're having issues, and the parents keep them out. They're like, oh, I'm going to keep them home today. It's not like they're being truant, like the kids are cutting school. There's something happening. And we see a lot of kids that are like having more and more absenteeism because they're somatizing a lot of their symptoms. They don't know what to do with them. And so they're having belly aches, tummy aches, headaches, and then parents keep them out. And then, and then they're more isolated, and the pandemic didn't help any of this. And it just kind of gets worse and worse. But you can see, anxiety, depression, withdrawal, all kinds of things can happen early. There are a lot of different screening tools, and a lot of people, if they have mental health training or basic training, that can look for some of these signs and symptoms for kids that just don't seem to enjoy things anymore. They don't play. They're being overly aggressive. There's some warning signs that you can look at, and some of those signs we noticed in especially our own kids. And that helped us kind of like start to say, oh, maybe we need to take some interventions and take some action.
Yeah, I mean, coming from California, which seems, pretty typically a pretty progressive state, to Kentucky, which I don't maybe isn't as progressive as California. How do you like see the stigma about mental health, or what do you tell your patients and families about kind of destigmifying being, taking care of your mental health?
Yeah, it's interesting. A lot of there's some pushback. I think the way that the level of presentation that I see when I'm in the hospital, it makes it a little different. Like if you're talking about depression, anxiety, and a kid has just taken a bunch of pills, or they try to drive their, ATV off a cliff or something, there's a different level that shocks people.
The parents are way more.
Yeah, and sometimes they're like, oh, okay, we're at the end of the road, right?
Right.
And so I may not see that as much, but if you're talking about it like my colleagues in clinic, or you're talking about ahead of time, they may be like, So I don't see that as much, but we do see times when people are in denial about that. And I think just because of the nature of what I do, I don't see the difference in at this level in the progressive state versus more conservative states. That doesn't pop out to me as much. I think in the school setting, or like in a clinic setting, maybe you would see that. But when there's a crisis, people tend to come together and are a little bit more willing to look at things. But the problem is the crisis is like everything's on fire, and there's risk to life and limb, and it's sometimes we can't save kids. If they've had a suicide attempt, they may have done too much damage that we can't bring them back. So it's a little bit of a different scenario from my perspective, but I'm sure others, there's others in the community that might be able to better kind of talk about that part.
The data that, at least that's been reported, is that there has been a spike in self-harm and worse. Is that what you're seeing as well?
Correct. Yeah, we're seeing increased suicide attempts. I think there's like a thing about the data that we continuously are pitching and are talking about and pitching in our startup work, and looking at the Children's Hospital Association data that's come out there. I think it's like seems like 153% increase in like ER visits for suicide risk. And the numbers are just astronomical. I've seen some estimates of like 1 in 3 kids will have probably some kind of active mental health issue at the moment. Those are probably high numbers, but I don't have the data in front of me. But generally, hospital admissions are up, ER visits are up, suicide attempts are up, anxiety and depression is up, and that's affecting not only things in the school system, and then like capacity is down in hospital systems, and people are boarding in ERs and wards and not being able to get into mental health facilities. There's long wait lists. So like when you wait for this to happen, the system becomes saturated and then can't help, right? So that's where I think preventative care, pushing ahead, catching things early, even doing things where you can have school counselors and other mental health professionals do preventative stuff early and kind of solve the mild problems so you don't get to this crisis is really vital.
Yeah, I mean, I know you just mentioned your work with startups, including us, obviously, but Maro and a few others. Congrats on Maro winning the ASU GSV Cup, and can you share more about Maro and mainly about how do you see technology to help with this prevention, and how do you see technology making your job easier in the future of the role that technology plays?
Yeah, so I can talk a little bit about Maro. The easiest way to explain it is that it's a digital healthcare marketplace to specifically help kids solve some mental health issues that they're having, like anxiety, depression. We'll do some ADHD work down the roadmap, maybe eating disorder, and add on other things. And I kind of describe that marketplace like a Netflix-like model, where we try to sell our content to our platform to schools, so they can have a platform where we provide education, professional development for teachers, modules for kids. We teach people how to identify issues. We have like internal communication systems within the school, so teachers can escalate to counselors and vice versa. And then we have a parent companion app where the communication can go to the parent, right? And we provide the same education modules for them. We can do consent back and forth from the school. We can basically solve a lot of the logistics that are really terrible right now, that are causing unnecessary problems. We're trying to basically follow each state's legal issues around opt-in, opt-out. We have to navigate FERPA, HIPAA, so all these different compliance regulations, but we have a platform that we think can do it, and a design that we think will work for it. Ultimately, we want to we're also doing mental health screening and trying to have an easy referral mechanism where both schools and parents can say, okay, we've seen something, we can talk to each other. We maybe have used a mental health screen virtually or in person, saying, hey, there may be a risk of a flag. We need to get a better diagnosis. So we would go to a partner, and if the school has their own school psychologist and they have 10 counselors that can do, great. The reality is most schools don't, right? They're resource driven. So having other partnerships out there is important. And so we have on Maro, we're a platform that then serves up the options, kind of like Netflix will have all your different movies out there. We have our different virtual care providers. We have like 6 or 7 virtual care providers. And we're bringing in the next part of the roadmap is to bring in then brick and mortar support systems that are co-located in the community that the schools and the families are in. And so we want to basically open up options, streamline communication, get consent process, provide a way that everyone can navigate the legal issues, send information and share information. And then people have choices. You don't just have to say, the therapist in my neighborhood, I can't get in for 9 months. It's like, well, we can find other options, right? At the same time, we want to allow you to, all that information can be sent to the pediatrician or your primary care doc or your primary therapist. We're trying to like open up the information flow and securely share everything, because we don't want to fragment care. We don't want to have care in like 10 different spots, but we want kids to get the access to care. If you're staying with your own doctor and you can't get seen for 9 months, it doesn't matter if you're fragmented or not, right? Right. So we're trying to solve all these logistics issues and identify the kids early and then detect the issues and then get them referred. And we think we have a platform that will work. We're early stage, but we think we have all the pieces that will make it work and be able to scale this. And we're an early pilot with schools and healthcare systems and families right now.
Yeah, no, and so I mean the screening bit is it seems like that. I know the Surgeon General came out that, or I forget which governing board said that from 8 years old and up that they want to do an anxiety screener. I mean, obviously prevention and staying ahead of it, it seems to be where things are going, right? How are these assessments though? Like the kids they're good at or bad at taking these tests, right? Or how accurate?
Well, it can be challenging. So we have some initial data coming in right now, and we've done our first like small batches, and I've of course jumped on them and analyzing the de-identified data and making sure we're not having any red flags and things like that. But I mean, it can be done. It depends on, we have to navigate like state law and school district preferences. Because we have to set up some ground rules so that we do this safely. We have to make sure that if you do a mental health screen and it flags with something dangerous, part of our terms is like, hey, you're going to refer to your system, and we actually say, okay, what's your pathway, right? And so if they don't have a pathway, we're like, okay, we'll build you. We have options we can do, or you may not be ready for this yet, right? So we make sure that's safe. We try to use the right clinically validated screening tools. And some of that's tough with different age groups. So we're looking at depression and anxiety screeners that are validated down to 12, which are really, really common, like GAD-7 and PHQ-9. But going down to 8, the choices become a little different and they're more complicated. Like if you use some surveys, there may be more questions, there may be longer. You maybe have to have somebody sit with the child and like kind of let them answer questions, right?
Yeah, because if they've been through it, or they know that what can potentially come down the pike, they may answer it differently, right? Or
that's always a possibility, right? And so you have to add context to all of this, right? So the school counselors, or if there's we actually prefer that there's a licensed or require that there's a licensed and credentialed mental health professional somewhere in the team, right, so that they can kind of manage the process. But they often don't have time, right? So we're allowing them to scale, and then we're going to say, here's your mass screening, here are your risk, and
well, yeah,
does it make sense, right?
Not specifically about Maro, just in assessments in general, but I think oh shoot, I just lost my train of thought.
Yeah. Well, I'll say assessments in general are they're not diagnostic tools, right?
Right.
They just tell us
like the COVID tests, right? Like the rapid ones. Like China used it really well to even though it wasn't 100% accurate, but it still screened people, and then you go see your provider if you really have it or not, right? Like that's kind of the concept, right?
Yeah, that's exactly the concept of screening. And so we're not attempting to diagnose, nor do we think, especially if a lot of schools have a counselor that's more of an academic counselor, or maybe they don't have the full services. We don't want the school to be diagnosing. We don't want to diagnose for them. We want to say, where's their risk? And then say, okay, does the risk make sense? Like, does this kid look like, make sure with the training that we're giving them, does this fit with the symptoms, or is this kid, faking their answers or whatever? But add some context, but then get them referred through our referral pathways, and we'll help this school. Like if the parents have their own pathway, great, go do it. If you get stuck, then we have virtual care options. And then we'll help build in brick and mortar options as we get into each community and build out. And certainly as we work with children's hospitals or even private practices in the area.
So we've been talking a lot about technology in terms of, in use in pediatric health, but in general, like how do you see it from, your personal use and your kids' use and just, the youth in general on the role technology plays and how it's all connected with their health in terms of, social media and screen use and all that stuff?
Oh yeah. Yeah. I mean, that's one thing we struggle every day with our own kids. And we have to manage, I think, our screen time and use of social media. It has to be really carefully looked at. because I think when your head is buried in a phone, like you're not going outside and playing, and you're not having those, you're not working through that difficult scenario with your friend next door, And I'm grateful, like we're in a community right now where the kids go out and they're playing, they're interacting, so they're fighting sometimes, they're resolving issues, they're doing normal kid things, and we try to limit their screen time. They do get screen time, but we're trying to limit it. And often, like the kids are getting so good at being aware of it, like our kids call out us, where it's like, "Dad, get off your phone." It's like, oh man, So we're always making those mistakes,
You're checking all your emails all day, right?
Yeah, well, yeah, that's yeah. Startup physician, right? Leader. So it's, but we have to check ourselves too. But I think those social media platforms are probably, on the whole of it, probably more negative, do more harm than good, right? And they're barriers to us interacting with each other. And I think technology is really careful. I think we have to limit it and live our lives and use technology peripherally. And even in healthcare, there's a lot of the diagnosis has to come down to that patient physician or patient clinician, whichever type of therapist or physical therapist or whatever it's the relationship between two people and working on it, listening and solving the problem. Technology, people talk a lot about ChatGPT and all these things. And we've looked at machine learning stuff, and I've seen machine learning go bad in like pediatric sepsis prediction, and then looking at models that do better. You have to basically train any type of artificial intelligence of those things on lots and lots of patients, and you're teaching technology like you teach a child, right? And then what you teach it, if you teach it the right things, it'll come up with conclusions that are generally more correct. But you can teach it the wrong things or skew data sets, and then it's going to not give you the right answer. Like if you teach it about what things look like for white populations, and then you apply it to like, populations of African American women, it may totally get the wrong answers, right? And then the bias that can be exhibited has to be really carefully managed. So I think for at least the time being, or probably my lifetime, I'd be surprised to see like technology taking over like healthcare in a way that people think. It's not going to be diagnosing for us. It's going to be assisting us move faster, can provide things to think about, help with logistics, information sharing. Yeah, but it won't take over that clinical intuitive like thought, because ChatGPT can pass an entrance exam but those questions are queued up to be classic questions, right? When you talk to real people, the information gathering is weird. People don't want to say things. People kind of hide things, people speak between, you have to read between the lines. You have to read people's facial expressions. It's a lot harder dealing with sophisticated diagnosis as a person. And we certainly get it wrong, but I think technology will be helpful, but in a different way. It'll help us do our job better and faster. But it's not going to take over that job, if that makes sense.
Yeah, like, in terms of even telemedicine and teletherapy or telecoaching, for us, we started down the path of, content and building out an app and even a chatbot and, putting in questions that we think kids would ask. But kids are, especially teenagers, their main mission is to break things, right? Like, and ask questions that chatbot probably doesn't know, right? So we found that, when you meet them, and I think, did you share the story or someone story about, some hospital or company that their, healthcare benefits, when they called them and actually spoke to them, there was much more engagement of people trying to be healthier, as opposed to just, reading a chatbot or being, notifications on their phone, like that human connection. Obviously, you're, in the hospital, your bedside manner has to be. Is that something that you worked on in your career, or is that natural?
You have to, and I've had moments where I've had less than proud moments where I've like not been so great, but for the most part, I pride myself on having good relationships. But you always have to be cognizant of your own mental health and where you're at, and check your own pulse. And when you're stressed and fatigued and exhausted, hearing just another problem is going to weigh on you, and then you're not going to be your best for your patient. So it's really about helping find ways to take care of yourself and put yourself in situations where the system is taking care of you as a healthcare provider too, and you're not feeling crushed all the time, you know. So, and there's always, you know, like I'm signing up for a training to work on communication, to improve my own skills. You always have to be aware of that. And I teach like culture and communication and teamwork stuff for hospital systems myself. You know, and you always have to be doing that. I do some executive coaching on having people think about things, and I've been coached and will be coached in the future. So we're always like working on our communication and trying to perfect. Think
like
about
sharing bad news, right? Like how that can't be easy.
No, it can't. That's a whole art form to that, you know, and it's really challenging. So that could probably be a whole other bonfire chat in and of itself.
Well, so I mean, you know, in terms of the opposite side, in terms of crisis, the prevention side, like where do you know, I know you're paying attention to a lot of different startups and things that are happening in the space, but how do you see, like, you know, companies like us at Maro, you know, playing a role like on changing, you know, pediatric healthcare?
Yeah, no, that's a great question. I mean, part of the reason that, like, you know, I love like the concept of Bonfire and Maro is that I think it's getting back to some of my roots from Kaiser about like, how do we replicate that population health, that system that is just like a machine that can just screen lots of people, do it at scale. It does the basic fundamental things over and over and over again and does it right, and catches it. And then you escalate when you need to. But the number of crises are lower because you're putting out a fire, you know, before it starts, right? And so
actually, it would get you less patients coming through the door, right?
Well, so what's wrong with that?
No, I know.
I think like no, I'm just I will say that, you know, I'm like, if I do, like, I'm also like a systems guy and a quality improvement person and a safety person, and part of me is like, if you build the perfect system and I'm here as a hospitalist, like, can I put myself out of business?
Right.
You know, and then I'll of course have a new business, right? I'll do something else. But I mean, that's, you know, like my own personal philosophy is that the fee for service system, if we're worried about generating revenue, so we're not going to do the right thing. So we get more patients coming in crisis, so we can charge more in acute care systems. That's the wrong thing. That's a wrong incentive to have, right?
But it seems to me that that is the American system, right? I mean, generally.
Well, that's one that, you know, and I'm not gonna sit here and point fingers.
Yeah, that's
say what everyone's intention
is,
right?
Too.
But yeah, that's another podcast too. But the American healthcare system, I mean, when you have a fee for service system, like wherever you are, whatever country you're in, right? It is incentivized to do those things, to like pay for some of those things. So the newer moves in recent years to going to what they call value-based care systems, or like things that like Medicare, you know, are doing, or like some of the work of Kaiser or Intermountain, big health systems.
You know, basically incentivizes to make them healthier as opposed to,
yeah.
You know.
Well, yeah. I mean, you have to have those payer models if you're going to use insurance companies where you're paying more. Like, imagine a system where you paid more to prevent something, or to talk about smoking cessation, or to do you know, depression or diabetes screening, and then you do preventative counseling if you have mild symptoms, right? If you're putting your money, like you throw your weight in, you're going to go in there. That's going to create a different system, and it's going to disrupt healthcare would be disrupting itself, right? That means you'll get fewer patients coming in the door, and but the problem, I mean, there'll always be sick patients. There'll always be kids that have suicidal ideation or have eating disorder. If you do prevention the way I look at it, and you maybe leverage technology to recreate that population health strategy virtually, or like in a hybrid method, you're going to control some of the problems a little bit. You're going to tamp down. You're never going to make it go away. So you're going to control it so you can basically better manage the capacity of the kids or whatever, the patients that are the sickest, right? And so it's always going to happen. But if you let it go and don't do any prevention, then we're overwhelmed, right?
Right.
And then we break down and we can't help people, right? And it's more expensive, and the healthcare dollars that we have are limited, right? And it's like you have to think about like where are you going to invest your money, right? Are you going to wait till the person has a heart attack, or can you invest and have people like eat healthier and exercise better? My own, I need to do better myself, um, but I mean, if you prevent, those are the things that can make a difference, and I think Maro and Bonfire have the opportunity to do the things that like a big expensive health, it's a lot of infrastructure to put in like a Kaiser, in multiple states, right? But if we can form it in the like virtually with systems like that are able to do those things, screen, and then they're able to collaborate and connect easily with the brick and mortar systems, right? We like it's never one or the other. It's like everything together, right? You bring all your tools to bear. Um, I, I think that that's going to give you the best chance at getting population management, maximizing preventative care, and getting better like healthcare outcomes, and hopefully value-based care. If they're paying to do those preventative things, which is out there, and we can really get effective, like really effectively deliver at scale the prevention, and at scale get people to like shift a little bit of the money over, then people are gonna follow the money. It's like Sutton's law, they're
Right.
money. Oh, it's money's in value-based care. Let's start to prevent, right? And a lot of social, like you see countries that have more socialized medicine. That's where they're putting their focus in, and you can still have a free market capitalistic system that does healthcare prevention.
Right.
I work. Kaiser's not socialistic. It's a capitalistic machine, right? But
Right.
it does that well, right? Intermountain, same, and others to do it. So I don't think you have to be this like, oh, you can't do that because that's like, you know,
Well,
un-American. I like
there's a
your
lot
philosophy.
of there's always labels and stigmas and calling prevention sometimes is it maybe not even, I mean, it is what we're trying to do, but then optimizing and promotion, those are other things that maybe kids can come around calling it coaching as instead of like therapy or prevention, because we are trying to prevent the worst, but I feel like we're also, because of social media and a lot of the distractions, there's the productivity is not as good, and the anxiety is a lot higher from not necessarily clinical anxiety, but they're just not living healthy lifestyles.
Yeah, no, I mean, and that's where I think like Bonfire, like getting ahead and resetting to a lifestyle where you can better manage stress and become more resilient. And we're teaching the right things and setting the right language and getting rid of the stigma and say, how do you feel? That's okay. You have to address it, right? Because if you don't, it's gonna get you later, right? That's the right method to be in. That's totally preventative care. Like that's exactly what you're doing, and that's ultimately the right thing. It creates a healthier society, creates healthier adults.
Yeah, no,
So
we're
it's the right
seeing
direction
it.
to go.
We're seeing it with, because it is really just comes down to that connection between the coach and the kid, or even the provider and the patient, right? That when the patient trusts you, they will be more willing to listen to what you tell them, right? Like, or advice that you give them, but also just feeling seen and heard. Like the kids love it, but I think all of us adults, like to get validated, especially from our wives, right? Like, but what, speaking of Bonfire, like what is it, I know it's been over a year now, but what was it that drew you to getting involved, and what role do you think coaching plays, and just being optimizing kids' health and kind of the future of healthcare and overall well-being?
The thing that I like about Bonfire is that it helps you create healthy habits. It helps you address things early on. It's all about it's really like philosophically about prevention. It's like let's live well, right? Let's put down the phone. Let's and I think if we move toward that, it's better. It's doing the right thing. It's doing the right thing at the end of the day, and taking the right strategies and building relationships. And those are vitally important. The technology is, we don't want to have a technology interface as the relationship. We want the technology to enhance lots of different relationships and facilitate it happening when it's difficult, right? Or facilitate like, connecting, or facilitate like the payment models or whatever, or just getting the information passed on to the people that need it. So your pediatrician's like, oh wait, this kid's in trouble. Like, how can we share that information? I think that's where the future of technology is, and I think Bonfire is in the right spot to do that. But it's not in this big fee for service. Like it's like if you look at the business model, you're like, oh, we're going to make a bunch of money because you're actually doing the right thing. And I think it would be interesting to see if there's a value-based care angle or preventative health management angle with what Bonfire is doing. I think
Yeah,
that'll need.
I mean, I know a lot of them, the insurance companies, obviously, they try to incentivize for doing certain working out and certain, you're having your blood pressure at certain levels, all that kind of stuff. So, the kids part of it, though, I mean, you being a, high pressure job, what is, you're probably good at balancing and not thinking of your kids all the time when you're at work, but like, what is the number one thing that's causing you, concern while you're at work, right? I mean, I'm sure you are probably thinking about your kiddos, right?
Well, interesting. I'll say we so far we just did a very small pilot study, but like at Maro, we worked with a payer and did a pilot, and so we engaged. It was less than 100 of their workers in this group, and they were on Maro, and we were able to survey a small chunk. We wanted to survey more, but so we surveyed a small group, and it was surprising that a lot of them, when they're at work and their kids have mental health issues, their mind is on what's happening. It's like they're not thinking about their work. They're thinking about their family or stressed about their family, and that affects their productivity. And then it's hard, when they go home. And it was interesting so we used Maro Parents, our parent companion app, before we started moving the school product, and did that with some families and got some data. And they were saying, yeah, we love that. Like, we get to prevent it, the information, which is similar to like a lot of the things that Bonfire does with like coaching. You're giving like information ahead of time to say, here's what to look for, here's what to think about. When I sat down with the Maro app and I was looking at it, and my oldest daughter came and looked over my shoulder, and we went through the anxiety module together. And it's really like, it's almost like a cartoon bear. It's really colloquial. It's really easy to understand, kind of like 6th grade reading level, really accessible information. And it was like, great. It's like me and my daughter. And then the next day she's like, hey, can we look at that app again? And we were talking, and she's like, oh, I feel anxious. And I'm like, oh, and it normalized, like, so we had a father-daughter moment. We like normalized that conversation. And it was really, really fantastic. And I think whether you do that, so when we did that companion app in that small study, we showed that like there's evidence out there, like little bits of evidence that people are distracted, they're concerned about this, they're really worried, and maybe we can help them. They felt reassured by having a tool early on to prevent that, with that little smoldering anxiety that's coming up. So we had some early evidence that parents really liked it, right? And so
the kids too, because it sounds like a lot of the kids, they, it is really competitive out there, right? And they do see the threats that are happening, and luckily, like you said before, like kids are resilient. There are kids that do. It's a lot harder. Obviously, you went to med school, and there was a lot of pressure that you had to go through to that. But for most kids, things have changed a lot in 10, 20 years, or even 5 years, in terms of the distractions and how competitive it is to get into colleges, especially California colleges and all that. So
yep.
it seems like they are more willing to try to be on top of this stuff.
Yeah, kids are resilient until they're not. And yeah, so I think it's important to be on top of it, and that's why like groups like Maro and like Bonfire are doing the right things, being in the right space, right? And I think it's helping parents. I think it also eases parents' anxiety, right? And parents' mental health. Kids feed off their parents, and if you're stressed, they're really intelligent, like sentient beings, and they're like gonna see what's coming off, right? What's kind of like emanating from you, right? So if you're stressed and you're angry, you're going to transmit that to them, and you're going to lead to issues there. So
modeling, right?
yeah, and so whatever we can do to kind of diffuse that, I think is really important. And I think startups like this can play a role. And even if they're like a lot of what Maro's doing, we're dragging people in to say, you need help right here, right now with this child. or this school district is suffering, or this community that has these social determinants of health is suffering, it's right here. Let's flag it, get in here, help them. Let's help them early, because you're going to be seeing them in the ER later, or you're going to, you're going to try doing CPR on them when they try to commit suicide. And it's, who knows, right? It's going to be a lot worse to fix later, right?
Yeah, no, we're proud of you and Kenzie and all the work at Maro. We're looking forward to being part of the platform, and hopefully we get Kenzie on one of these calls next. It's coming up soon.
Oh yeah, she's fabulous. Yeah, she would be fabulous. She is sophisticated and passionate, and great communicator, and really loves the vision. I love working with her. She's a fabulous CEO, and I think Bonfire also is really going in an amazing direction. But the thing about this space, being a startup, and it's really hard work, and just have to keep plugging at it. The timing is right. The need is there right now, right? And we just have to make sure that we're connecting with what people need and solving the pain point. And I think we're kind of in the right realm for that.
Yeah, I mean, I think stigma is definitely one of the main things, right? That I think that we have to try to compete against of not my kid, or because the kids don't share a lot of things with their parents, right? And I'm sure you may hear it from parents, or maybe, when they come into the ER, that I had no idea that they were even suffering from something, right? I mean, do you get that at all?
Yeah, no, I do, and that's maybe, I think it's really challenging because my kids are not, they're preteen, right? So they're not, and who knows what's going to happen, but because you don't hear of those things. But I think maintaining those family connections is really important. And how can we be in kids' lives and be connected, and put down the technology and the screen, and develop the relationships where you do know, or you have a trusted bond, and they'll come to you and talk to you. They're going to be, they go through adolescence. They're testing, they got to move away.
They're not preteen yet, right? Wait, mine are much younger, so I know it's coming that I'm not cool dad anymore.
So yeah, no, I'm gonna get door slammed in my face and all that, but you have to just try as hard as we can to stay connected with them, and I think and sometimes have our focus on them, and that may help a little bit. We'll see what happens. I'll tell you in like 4 years, like how I'm doing. I'll look back at this podcast and go like, oh my God, I didn't know what I was talking about.
Right. Well, yeah, who knows what's going to be happening in 4 years, right? With everything that's evolving so fast.
Yeah, exactly. But I'm positive. I try to be optimistic. I think there's hints that we understand what the problem is, and there's people focusing, there's attention focusing on the right problem. And there's so in the startup world, the funding is not necessarily directed at the right spot, and is legislation set up to allow us to destigmatize mental health and share that. We're not totally there yet, but I mean, the fact that there's lots of, we're saying we have a mental health crisis in this country, and there's lots of interest in people doing it. The legislation is changing. We're helping with advocacy work in one of our states. We were talking to state senators about, what's the right thing to do, what's the evidence, how does school performance get affected, like what's in it for each group, right? Why is mental health important in schools? Because kids aren't going to, the graduation rates are going to get affected, academic performance is going to drop, absenteeism is going to go up, behavioral disruption will go up. It's really in schools' best interest to make sure that they have a healthy population, and are doing well.
Yeah, I mean, I've only, been, in the K-12 or studying it in the last few years, but, it seems that, we talk about whole child approach, and, from top down, there's a lot of, every school kind of promotes that, but in terms of how do they really reach out to each kid to make sure that they're healthy, they're eating, even when they come to school, they may get free lunch, they don't know if they're eating it or not, and they're certainly, given a lot of homework, some schools where they're not getting 9 hours of sleep, right?
Oh yeah, no, and the truth is they're not resourced or equipped to be able to do that, right? I mean, a teacher's life is hard. One of my best friends is a teacher, and is a really great high school teacher, and has a lot of advanced training and has done some leadership. We're actually he's actually loved the Maro model, and that's one of the school districts were involved in, because they had said, wait a second, this is resonating with the problem we have. And like, as he repeats back the problem to me, he tells me what the problem is like, they don't have time to do that. There's so many things that they're measured and held to. They're doing their best to like get through. They have to teach them too, and then kind of be their parents during the day, you know. And it's hard. They don't have the bandwidth to do all these resources. They need help, you know, and they need streamlining and efficiency. And we do have to stop and look at you know, try to avoid taking our shiny technology thing and shoving it on them and going like, wait a second, what does your world look like? How can we design something, an ecosystem that fits around you, right? And enhances what you do. I think Bonfire has done that. I know Maro, like we have a school counselor in our midst and has thought about, it's like, oh, these are all the terrible things that I experienced, and here's how I can make it better. And
we talk to school counselors every day, and you know, they all 500 to 1 ratio, right? They have 400 or 500 kids in their caseload, so they barely get to see them, you know, once a semester. Obviously, some of the kids that are, you know, more high risk, they get to see more, and they deserve it. But there's so many kids, you know, that just kind of slipping through the cracks because they're just not enough counselors. But you know, they're the best though at connecting with kids, but they're just spread so thin, they don't really get to coach kids on the regular. Like you know, there's a lot of ads, there's a lot of fires to put out. You know, we're getting them, you know, to work part-time after school. So, you know, and they do get to come back to what they really got into the career for, is like making connections with the kids, motivating them, you know, inspiring them to do the basics that most of us aren't doing, adults included. You know, so when you talk about behavior modeling, you know, we need to coach the parents too, because, you know, but they don't have time for this stuff, right? It's all about time. But if you think, you know, the people that are smart, you know, obviously the C-suite people that have the resources, they got all these coaches and, you know, someone to work, personal trainer, they got to better up for their, you know, business coaching. They got, you know, all these different people in their lives to help optimize their performance. You know, I think kids, you know, need that too, especially now.
Yeah, absolutely. And hopefully, because it's hard and expensive, and schools, you know, aren't usually like overflowing with cash. I mean, hopefully you know, some of the efficient and digital models can help enhance some of the work they're doing and make it more efficient. I mean, like my buddy is like he's saying, if I see something's wrong with a kid, I want to tell my counselor. It's like, I'm worried about this student. And he made some comment to me. He's like, his day is so crazy. Sometimes he won't see the counselor for like 2 weeks. And he'll so 2 weeks later be like, oh, I'm worried that kid wants to, you know,
a lot
has some issues, right? And it's like, even that part, like when we built our platform, we're like, we want instant, like, it's like, hey, you can send the flag over. It's like, through our internal system, you know, to solve, we just listened to what the pain point was. And we were like, really? It's like, talking to the counselors, the hard part. And they're like, yeah, it's like, you don't know what I'm going through, right? And so we have to be open and listen.
You know, the whole, that is another topic as well, in terms of the attrition and the burnout, and, you know, the lack of support that a lot of the teachers. So, you know, props to him for doing this. And, you know, part of what, you know, we see why the coaches like to do it is that it is a kind of natural dopamine, you know, boost that you get when you are helping a, you know, someone, a human or a kid, especially. That's why he comes back every day, I'm sure, to, you know, kind of put up with all these you know, things. But it's, you know, the wins far out, you know, kind of make it worth it, right? When you see a kid come back to you a couple years later and say thank you, you know, for inspiring me, you know, that kind of stuff.
Oh yeah, my friend is that teacher that happens. He'll run into someone in the grocery store and they're like, thank you, Mr. Hall, for do. And I hear this, I'm like, oh, you know, and he's like, it's, you know, but I mean, that stuff, you know, we have to take care of the people that are taking care of our kids.
Yeah,
is what it is at the end of the day. And where are our resources going? You know, what's our priority? Like, I think that's the biggest message I'd have. It's like, why don't we redirect more of our resources to building our future, right?
And part of
and
that,
their kids.
is the parents, right? Like, because there's you can't really rely on the government. A lot of people don't, like or the schools to kind of have all the answers, and certainly many schools are pointing the finger to the parents who are like, hey, they're at home with you, like you're supposed to feed them and make sure they're healthy and not yelling at them all the time and abusing them, like so that's the hard part of this kind of cycle that we're trying to break, right?
Absolutely. And yeah, and I don't know. I mean, it's tough. I think parents are in a really difficult spot that's even harder now.
Right.
And many of them are doing the best they can. And I I feel like I'm doing the best I can. And then at the same time, I'm like, God, I didn't do a good, it's like a terrible parent this week,
Well, but
and,
every
you know,
parent
it,
goes through that, and there's so many more resources now. Like obviously us, but like but there's so many academic tutors or mathnasium. Like obviously there's sports coaching and SAT prep and all these other things. But there's a big gap when it comes to like mental health optimization and kind of building these skills of resilience and interpersonal skills that
yeah,
hopefully that's something that parents will look at, that hey, to compete today we do that's part of our budget to like get them into a good career or a good future, right? Like and not just like the career success, but their mental health, and that they're not also repeating some of these like generational kind of crisis that we a lot of us seem to be in, right?
yeah. And then we'll change that. And then we'll go have our new generation. We'll make different mistakes, or the new generation will, right?
Yeah,
It's always how it goes, right? And then,
yeah, yeah, yeah. All right, man. Well, I appreciate your time, and I don't know if you have any other thoughts you want to share, or
oh no, I mean, I'm just grateful to get a chance to talk about the subject is near and dear to my heart. And I think, like, preventing the futures in our kids. And I think prevention is key, and how we can get ahead of the problem. As one of the guys who knows, when you get downstream and things look really bad, it's a lot harder to salvage and fix our mental health, right? And so we want the best for our kids, and I want the best for my kids too. So um, I think these tools have great promise for the future, and hopefully we can keep hitting success and make it work for schools and families, and most importantly the kids.
yep. All right, Tariq, thank you very much.
Thanks so much.